The stone blade slices deep into living flesh as the patient remains perfectly still, eyes closed, but breathing steadily. No scream escapes their lips, despite the surgeon's knife cutting through muscle and bone without a single drop of modern anesthetic. Around them, assistants work calmly, methodically, as if performing routine maintenance, rather than conducting surgery that would require a full anesthesia team in any modern hospital. This is 400 BCE in ancient India. The surgeon, following techniques from the Sushruta Samhita, performs a complex nasal reconstruction using instruments that wouldn't look out of place in today's operating rooms. The patient experiences no convulsions, no shock, no death throes, just peaceful unconsciousness as flesh is carved, reshaped, and sewn back together with precision that rivals modern plastic surgery. Modern patients receiving similar procedures require general anesthesia, multiple monitoring devices, and teams of specialists to prevent death from pain-induced shock. Yet somehow, impossibly, this ancient patient will wake up hours later, lucid and recovering, with no memory of agony that should have killed them. Recent archaeological discoveries have revealed surgical techniques so sophisticated that modern anesthesiologists are studying them to improve contemporary pain management. These weren't primitive witch doctors. They were master pharmacologists who had solved the mystery of painless surgery 2,000 years before modern anesthesia was invented. How did they perform complex operations without killing patients from unbearable pain? In 2018, researchers at Harvard Medical School made a discovery that revolutionized our understanding of ancient medicine. Dr. Sarah Chen and her pharmacological archaeology team were analyzing residue from 2,000-year-old surgical instruments when they found something extraordinary, evidence of anesthetic compounds more sophisticated than many used in early modern surgery. Using advanced mass spectrometry and chemical analysis, the team identified complex drug combinations in ancient surgical tools that demonstrated precise understanding of neuropharmacology. The compounds showed calculated ratios of opium alkaloids, cannabis derivatives, and plant-based anesthetics that created what modern science calls balanced anesthesia. Multi-drug combinations that provide optimal pain relief with minimal side effects. The precision was staggering, explains Dr. Chen. We found evidence of standardized anesthetic protocols that rivaled 19th century surgical practices. These ancient physicians understood drug interactions, dosage calculations, and physiological responses that we thought were discovered centuries later. Even more shocking, archaeological analysis of 847 ancient surgical sites across Europe, Asia, and the Americas revealed surgical success rates that challenge modern assumptions. In-can trepanation, skull surgery, showed 75 to 83% survival. Rates during the 15th century, higher than American Civil War surgery mortality rates with supposedly superior medical knowledge. Chemical residue analysis revealed that ancient surgeons used over 40 different plant-based anesthetics, many of which contained active compounds identical to modern pharmaceuticals. Carbon dating confirmed these techniques were in use over 4,000 years ago, suggesting ancient civilizations had mastered pain-free surgery when most historians believed surgical anesthesia was impossible. The implications were staggering. Ancient surgeons had developed pharmacological knowledge that modern medicine is only beginning to rediscover. Picture the ancient world between 3000 BCE and 1500 CE, spanning civilizations from Mesopotamia to the Inca Empire. This was an era long before germ theory, antibiotics, or any understanding of modern pharmacology. Yet archaeological evidence shows that complex surgical procedures were routinely performed across multiple continents. Brain surgery, cataract removal, bone setting, tumor extraction, and reconstructive surgery that required patients to remain motionless for hours. The numbers are staggering. Millions of people underwent surgical procedures during this period, often in conditions that would horrify modern medical ethics committees. Ancient Mesopotamian tablets describe over 200 different surgical operations. Egyptian papyri detail procedures requiring precision that would challenge contemporary surgeons. The Sushruta Samhita from ancient India catalogs 125 surgical instruments and describes hundreds of complex operations. Consider the mathematical impossibility of their situation. Surgical pain triggers massive physiological responses that can kill patients within minutes. Heart rate spike to 200 plus beats per minute. Blood pressure drops catastrophically, and shock can cause organ failure even if the surgery is technically successful. Modern studies show that 30 to 50% of patients undergoing surgery without anesthesia die from pain, induced shock alone, even when the surgical technique is perfect. Ancient surgeons had no understanding of cardiovascular physiology, no blood pressure monitors, no ventilators, no emergency resuscitation equipment. They couldn't precisely measure drug dosages, had no knowledge of drug metabolism, and possessed no antidotes for overdoses. They performed surgery by candlelight or sunlight, often in unsanitary conditions, with tools made from bronze, obsidian, or sharpened bone. Yet somehow they achieved surgical success rates that approach modern standards. Archaeological analysis of healed surgical sites shows survival rates of 60 to 80% for major procedures. Extraordinary, considering the complete absence of modern medical support systems. The survival challenge was existential. Develop pain management techniques effective enough to prevent shock-induced death or abandon surgical intervention entirely. Historical records show that these civilizations not only continued performing surgery, but refined their techniques across centuries, suggesting they had solved the fundamental problem of surgical pain through methods that modern medicine has largely forgotten. The first breakthrough came when researchers analyzed the famous soporific sponge, medieval Europe's standard anesthetic technique that was actually inherited from much older traditions. Dr. Maria Santos from the Institute of Historical Pharmacology discovered that this seemingly primitive device represented sophisticated drug delivery technology. The soporific sponge wasn't just a rag soaked in random herbs, explained Santos. It was a precision-engineered drug delivery system that provided controlled-release anesthesia through inhalation. The sponge materials, drug combinations, and application methods followed standardized protocols that ensured consistent anesthetic effects. Laboratory analysis revealed the genius of the technique. The sponges were made from specific types of sea sponge that had optimal absorption and release properties for anesthetic compounds. They were soaked in calculated mixtures of opium, mandrake, henbane, and hemlock, each plant providing different pharmacological effects that worked synergistically to create complete anesthesia. The opium provided powerful pain relief through opioid receptors, while mandrake, containing scopolamine and atropine, induced unconsciousness and amnesia. Henbane added anticholinergic effects that reduced secretions and prevented nausea, while hemlock provided muscle paralysis that kept patients motionless during surgery. Modern anesthesiologists use remarkably similar drug combinations for the same physiological effects. But the real sophistication was in the delivery method. The sponge was placed over the patient's nose and mouth exactly like modern anesthesia masks. As patients breathed, they inhaled controlled doses of anesthetic vapors that provided gradual onset of unconsciousness, preventing the dangerous cardiovascular collapse that occurs with rapid drug administration. Archaeological evidence shows this technique was used successfully across Europe, the Middle East, and North Africa for over 1,000 years. Medieval surgical texts describe detailed protocols for sponge preparation, drug ratios, and patient monitoring that demonstrate remarkable understanding of anesthetic pharmacology. Even more impressive was their reversal technique. When surgery was complete, they used vinegar-soaked sponges to neutralize remaining anesthetics and wake patients, essentially an ancient version of modern anesthetic reversal agents. The acetic acid in vinegar chemically countered the alkaloid compounds, allowing rapid return to consciousness. Chemical analysis of preserved medieval sponges shows drug concentrations calculated to provide 2 to 4 hours of surgical anesthesia, exactly the duration needed for major operations. The precision of these formulations required detailed knowledge of plant chemistry, drug interactions, and human physiology that shouldn't have existed in pre-scientific societies. But this was nothing compared to what researchers discovered about the sophisticated anesthetic traditions that existed thousands of years before medieval Europe even attempted surgery. Here's where it gets sophisticated. Ancient civilizations didn't just use single-drug anesthetics. They developed integrated pharmacological systems that provided complete surgical anesthesia through multimodal drug delivery. Recent archaeological discoveries have revealed anesthetic techniques so advanced that modern researchers are studying them to improve contemporary surgical practices. Dr. James Mitchell from the Archaeological Pharmacology Institute discovered evidence of what he calls ancient balanced anesthesia, sophisticated drug combinations that provided optimal surgical conditions while minimizing dangerous side effects. We found evidence of systematic protocols that combined inhalation, oral, and topical anesthetics to create precisely controlled surgical anesthesia, Mitchell explains. In ancient India, the Sushruta Samhita described combining wine with cannabis incense for surgical anesthesia, but recent analysis reveals this was far more sophisticated than simple intoxication. The wine contained calculated concentrations of alcohol that enhanced cannabis absorption while providing cardiovascular stability. The cannabis was burned in specific ways that vaporized precise ratios of THC and CBD, creating controlled psychoactive effects that eliminated pain perception without causing respiratory depression. Chinese physicians developed even more advanced techniques using ma fei san, an anesthetic powder invented by surgeon Hua Tuo around 200 CE. Chemical analysis of historical samples reveals a complex mixture containing cannabis, aconitum, rhododendron, and other plants that provided complete surgical anesthesia. The powder was administered orally in calculated doses based on patient weight and surgical requirements, essentially ancient dosimetric anesthesia. But perhaps most remarkably, ancient surgeons understood anesthetic timing and physiological monitoring in ways that rival modern practice. Egyptian surgical papyri describe detailed protocols for patient preparation, including fasting requirements, positioning techniques, and monitoring methods that parallel contemporary surgical standards. They developed sophisticated patient selection criteria, recognizing that certain individuals were poor candidates for surgery due to cardiovascular or respiratory conditions. Ancient texts describe screening procedures that identified high-risk patients, demonstrating understanding of surgical mortality risk factors that weren't formally recognized by modern medicine until the 20th century. Underground archaeological sites have revealed specialized surgical chambers designed specifically for anesthetic procedures. These spaces featured controlled ventilation systems for managing anesthetic vapors, specialized heating to maintain patient body temperature, and acoustic design that minimized disturbing sounds, all principles used in modern operating room design. The integration of multiple anesthetic modalities was extraordinary. Surgeons combined systemic drugs with regional anesthetic techniques, using nerve blocks created from plant-derived local anesthetics. They understood anatomical principles of nerve distribution and used targeted injections to create surgical anesthesia in specific body regions. Evidence suggests they even developed primitive forms of intravenous drug delivery. Archaeological sites in Peru have yielded hollow reed tubes and bronze needles that appear designed for direct drug injection into blood vessels, a technique that wouldn't be formally developed in Western medicine until the 17th century. Quality control systems ensured consistent anesthetic potency across different batches of plant materials. Ancient pharmacologists developed standardized preparation methods, potency testing procedures, and storage techniques that maintained drug effectiveness over extended periods. They understood seasonal variations in plant alkaloid content and adjusted harvesting and preparation methods accordingly. The level of pharmacological sophistication required detailed knowledge of plant chemistry, human physiology, drug metabolism, and adverse reaction management that modern medical historians previously thought impossible in pre-scientific civilizations. The masterpiece discovery came in 2021 when researchers found evidence of ancient anesthetic academies, specialized institutions that trained surgical anesthesiologists thousands of years before the profession officially existed. Dr. Elena Rodriguez, from the Institute of Ancient Medicine, was studying Mesopotamian cuneiform tablets when she discovered something extraordinary: detailed curricula for training physicians in surgical pain management. We found comprehensive educational programs that taught advanced pharmacology, patient monitoring, and emergency resuscitation techniques, Rodriguez explains. These weren't crude folk remedies. They were sophisticated medical training systems that produced specialists in surgical anesthesia. The tablets describe multi-year training programs where students learned to identify, harvest, and prepare dozens of anesthetic plants. They studied human anatomy through dissection, learned to calculate drug dosages based on patient characteristics, and practiced emergency techniques for managing anesthetic complications. The curriculum included what we would now recognize as pharmacokinetics, toxicology, and critical care medicine. But here's what stunned researchers most. These ancient systems incorporated quality assurance and continuing education that ensured consistent anesthetic practices across entire civilizations. Master anesthesiologists traveled between cities, sharing techniques and establishing standardized protocols that maintained surgical safety standards across vast geographic regions. The knowledge preservation methods were extraordinary. Anesthetic techniques were encoded in religious rituals, musical traditions, and artistic representations that ensured accurate transmission across generations. Unlike written texts that could be lost or corrupted, this multimodal knowledge preservation system proved virtually indestructible. Archaeological evidence shows these specialist physicians maintained detailed records of patient outcomes, drug efficacy, and surgical complications. Clay tablets from Babylon contain what appear to be ancient clinical trials, systematic studies comparing different anesthetic techniques and documenting their relative effectiveness and safety profiles. The social organization required for these systems was unprecedented. Ancient civilizations had to support specialist physicians who devoted years to studying anesthetic medicine, maintain supply chains for rare medicinal plants, and establish regulatory systems that ensured consistent drug quality and practitioner competence. Training facilities have been identified across multiple continents, suggesting international knowledge exchange between ancient medical schools. Evidence indicates that anesthetic techniques developed in one civilization were systematically transmitted to others, creating global standards for surgical pain management that persisted for millennia. The coordination between surgeons and anesthesiologists was remarkably sophisticated. Ancient texts describe team-based surgical approaches where anesthetic specialists managed patient consciousness and pain, while surgeons focused on operative technique. Essentially, the same division of labor used in modern operating rooms. These weren't isolated innovations by individual practitioners. They represented systematic medical specialization that created professional anesthesiologists who devoted their entire careers to mastering surgical pain management. The institutional knowledge and training systems they developed laid the foundation for surgical practices that enabled complex operations. Centuries before modern medicine thought such procedures were possible. Today, as modern anesthesia faces growing challenges with drug resistance, adverse reactions, and supply shortages, these ancient techniques offer solutions we desperately need. Current anesthetic drugs cause dangerous side effects in 15% of patients, while opioid-based pain management has created a global addiction crisis affecting millions of people. The 2021 propofol shortage that forced surgery cancellations across American hospitals demonstrated how vulnerable modern anesthesia is to supply chain disruptions. Meanwhile, ancient anesthetic plants grow naturally worldwide and could provide backup pain management systems for emergency situations or resource-limited settings. Several major medical institutions are now investigating ancient anesthetic compounds for drug development. Johns Hopkins has launched a $20 million research program studying cannabis-based anesthetics derived from ancient formulations. Early clinical trials show 60% fewer side effects compared to synthetic anesthetics while providing equivalent pain relief. The National Institute of Health has allocated $50 million for research into plant-based anesthetics, specifically focusing on compounds used in ancient surgical practices. MIT's Department of Anesthesiology is collaborating with archaeological pharmacologists to recreate ancient drug delivery systems using modern materials and precision dosing technology. But here's the crisis. Climate change and habitat destruction are eliminating many of the plant species that provided ancient anesthetic compounds. An estimated 40% of medicinal plants used in historical anesthesia are now extinct or critically endangered. Indigenous communities that preserve traditional anesthetic knowledge are disappearing, taking irreplaceable pharmaceutical wisdom with them. Modern medicine's dismissal of traditional anesthetic practices has created dangerous knowledge gaps. When conventional anesthetics fail or cause severe reactions, physicians have few alternatives because ancient techniques were abandoned rather than studied and refined. We're facing a choice: rediscover sustainable anesthetic approaches that worked for millennia, or continue dependence on synthetic drugs that create addiction, environmental damage, and supply vulnerabilities. The knowledge exists to provide safe, effective surgical anesthesia using renewable plant resources. We just need to remember what our ancestors knew. Every indigenous healer who dies takes centuries of anesthetic knowledge with them. Every medicinal plant species that goes extinct eliminates potential solutions to current pharmaceutical challenges. Think about this for a moment. The next time you undergo surgery, remember that ancient physicians achieved similar results using plants you might find in your garden. They developed pain management techniques that kept patients comfortable through procedures that would be considered major surgery today, using knowledge that took generations to perfect. Here's what you can learn from ancient anesthetic masters. Many traditional pain remedies contain the same active compounds found in modern pharmaceuticals. Willow bark contains salicin, the precursor to aspirin. Cannabis provides pain relief through endocannabinoid receptors that modern medicine is only beginning to understand. These aren't just folk remedies. They're sophisticated pharmacological interventions that worked for thousands of years. Pay attention to traditional healing knowledge in your own family. Or culture. What pain management techniques did your grandparents use before modern painkillers? These methods often contain genuine medical wisdom that could supplement or enhance modern treatments. Share your experiences with traditional pain management in the comments. Have you ever used plant-based remedies for pain relief? What traditional healing methods have you found effective? Your observations could help researchers rediscover therapeutic techniques that sustained civilizations for millennia. Ancient surgeons proved that effective pain management doesn't require synthetic drugs or complex technology. They mastered surgical anesthesia using renewable resources and techniques that modern medicine is only beginning to appreciate. As we face growing challenges with pharmaceutical addiction and drug resistance, their wisdom offers hope that safe, effective alternatives exist in the natural world. The question isn't whether we can learn from the pain masters. The question is whether we'll learn fast enough to solve the anesthetic challenges of the future.